Cephalosporin is beta-lactam antibiotics used to manage bacterial infections by preventing their cell wall formation. This generation of cephalosporin provides stronger gram-negative coverage than earlier generations while retaining moderate gram-positive activity. They are effective against Haemophilus influenza and many enterobacteria such as E. coli, Klebsiella, pneumonia, and Proteus mirabilis that do not produce ESBL or AMPC enzymes. Fourth generation cephalosporin provide an even broader and more balanced spectrum with strong activity against both gram-positive and gram-negative bacteria, including Pseudomonas aeruginosa. They are more resistant to beta-lactamase enzymes, especially AMPC, and penetrate gram-negative bacterial membranes more effectively. Fourth generation cephalosporin also particularly important for treating severe hospital-acquired infections, febrile neutropenia, and infections caused by multi-drug resistant organisms.
Pharmacokinetics is effect body on the drug. Route administration for ceftazidime and cefepime is via intravenous IV and intramuscular IM. The distribution for ceftazidime are distributed into extracellular fluid and cerebrospinal fluid, while distribution for cefepime are distributed into white tissue such as lung tissue. Ceftazidime and cefepime eliminated by renal, excreted unchanged in urine. Half-life is time required for amount of drug in body to decline by 50%. Half-life of ceftazidime is 2 hours, while cefepime has longer half-life, which is 2 until 2.5 hours.
Third and fourth generation of cephalosporin are beta-lactam antibiotic with bactericidal activity. They will kill bacteria by inhibiting the bacterial cell wall synthesis. This drug acts on the peptidoglycan layer on the bacterial cell wall, which is essential for maintaining the cell strength and resisting osmotic pressure. Although this layer is thicker in gram-positive bacteria and thinner in gram-negative bacteria, it is vital for both. At the molecular level, peptidoglycan consists of N-acetylmuramic acid and N-acetylglucosamine chain that must be cross-linked to form a stable cell wall. This process is mediated by penicillin binding protein, particularly transpeptidase enzyme. The third and fourth generation of cephalosporin contain a beta-lactam ring that bind to the dis-PBP, inhibiting the transpeptidation. This prevents proper cross-linking, resulting in a weak cell wall that cannot withstand internal osmotic pressure, leading to cell lysis and bacterial death. Pharmacodynamically, the third generation of cephalosporin are effective against the gram-negative bacteria with good CNS penetration, while the fourth generation cephalosporin provide broader coverage and greater beta-lactamase stability.
Next is how to prepare before administration for cephalosporin drugs. Before administering cephalosporin, the first and foremost important step is to check for drug allergy. Patients with a history of penicillin or cephalosporin allergy may develop cross-reactivity, so this must be assessed carefully. Next, we must assess the patient's renal function. Both ceftazidime and cefepime are excreted through the kidneys, so dose adjustment is required in renal impairment. This is especially important for cefepime as the drug accumulation can lead to neurotoxicity. We should also confirm the indication and culture result, especially for ceftazidime, which is commonly used against Pseudomonas aeruginosa. Ceftazidime or cefepime is usually administered via intravenous or intramuscular routes. For IV administration, the drug should be properly diluted and infused slowly. Ceftazidime infused over 15 to 30 minutes and cefepime infused over 30 minutes. Rapid IV administration should be avoided as it may increase the risk of adverse reaction. During the administration, the patient should be closely monitored for hypersensitivity reaction such as skin rash, itching, shortness of breath, and sign of anaphylaxis. Another important point is drug compatibility. Cephalosporin should not be mixed with aminoglycosides in the same IV line, as these may increase the drug inactivation.
An example of ceftazidime is for TUS injection. Ceftazidime belongs to the third generation cephalosporin class. In terms of dosage, the usual adult dose is 1 to 2 grams given intravenously every 8 to 12 hours. For severe infections, the dose can be increased to 2 grams every 8 hours. Dose adjustment is important in patients with renal impairment to prevent toxicity. For therapeutic use, ceftazidime is mainly used to treat severe gram-negative bacterial infection. It is especially effective against Pseudomonas aeruginosa. Common clinical indications include pneumonia, urinary tract infection, septicemia, meningitis, and intra-abdominal infections caused by susceptible organisms. Regarding side effects, common ones include nausea, vomiting, diarrhea, and skin rash. More serious adverse effects may occur such as hypersensitivity reaction. In patients with renal failure, ceftazidime may cause neurotoxicity including confusion or seizures if the dose is not adjusted properly. Ceftazidime is contraindicated in patients with a known allergy to cephalosporin or other beta-lactam antibiotics. Next, I will move on to cefamine. An example of cefamine is mezipine injection. Cefamine is classified as a fourth-generation cephalosporin. The usual adult dosage is 1 to 2 grams given intravenously every 8 to 12 hours. For severe or life-threatening infection, the dose may be increased to 2 grams every 8 hours. Similar to ceftazidime, dose adjustment is required in renal impairment. In terms of therapeutic use, cefamine has a broader spectrum of activity. It is effective against both gram-positive and gram-negative bacteria, including Pseudomonas aeruginosa. It is commonly used in hospital-acquired pneumonia, febrile neutropenia, complicated urinary tract infection, skin and soft tissue infection, and intra-abdominal infection. For side effects, patient may experience diarrhea, nausea, headache, and skin reaction. Serious adverse effects include encephalopathy and seizures, particularly in elderly patients or those with impaired renal function. Cefamine is contraindicated in patients with hypersensitivity to cefamine, cephalosporin, or penicillins. In summary, both ceftazidime and cefamine are effective antibiotics for serious infections, especially those caused by Pseudomonas aeruginosa. But careful dosing and monitoring are essential, particularly in patients with renal impairment.
Today, I would like to talk about health education for ceftazidime and cefapine. These drugs go through IV line or IM line, which is intravenous line or intramuscular line, because the gastrointestinal tract cannot absorb these drugs well. Since these drugs are antibiotics, so the patient must finish the course of the dose to prevent from antibiotic resistance. Tell the healthcare worker if you are on this therapeutic drug, especially when taking a blood sample. This is because it can interfere with the accuracy of the test result. Alert the healthcare worker immediately if you feel any sign of allergy, side effect or adverse effect. For side effect of ceftazidime is jaundice, skin allergy, difficulty in urination, and vaginal discharge. For cefapine, it involves systemic. For example, neurological can cause neurotoxicity. Genitourinary may cause vaginitis and renal injury. Patient may have dysuria, which means difficulty in urination. For diet and lifestyle, avoid alcohol and smoking. Stop any contraindication or drug like diuretic for the time being. For precaution, notify the healthcare worker of any past medical history, especially in renal disease, gastrointestinal disease, and breathing disorder. Also, inform regarding any pregnancy, breastfeeding, or planning for pregnancy. That's all for me. Thank you.